to defeat COVID-19.
The government has launched a new national strategy to fight COVID-19 starting from the village level. Prime Minister Dr. Ruhakana Rugunda, citing the previous government approaches to fighting pandemics like HIV, AIDS and Ebola, among others, that had returned positive outcomes by starting with an individual at the village level.
We are formally calling upon, as well as handing over the ownership and the responsibility to control this disease, this pandemic, to individual Ugandans. In a nutshell, this is power to the people to defeat COVID-19.
He was accompanied at the event by his deputy Moses Hari, State Minister for Primary Health Care Dr. Joyce Kaduchu, and State Minister for Primary Education Rosemary Seninde.
It's empowering the household to be responsible and accountable for their own health.
Under the new strategy, government will pay a monthly allowance of 100,000 shillings to all village community health workers, commonly known as Village Health Team VHTs.
The investment, like we are going to do, of paying 100,000 shillings to one village health worker, the return on investment on that for Uganda will be much bigger than the investments that we are putting onto roads, to dams, and all those other infrastructure which we are doing.
The Village COVID-19 Task Force will comprise of LC1 chairpersons, a community health worker, parish chiefs, community development officer, the religious and cultural leaders, schools representatives, health facility representatives, civil society organizations, volunteers, and the private sector. However, the decision to pay an allowance of 100,000 shillings to only one person on the village health team has raised curiosity.
Even the LCs were saying, what about us? We also want money. So after the discussion, it was agreed that if you split the money, it is too little. So let's appoint one person who will spend more time on the work. The others will just be supporting that person at a lower scale.
Currently, there are 70,626 villages in Uganda. This means the taxpayers will dig deep into coffers to raise over 7 billion Uganda shillings every month. The Red Cross will also be a key partner in the implementation of the Village COVID-19 Task Force.
Our managers at the districts will work with the district health teams in coordinating the activities of this community engagement in the district, whether at the time of training.
The government says the National Engagement Strategy for COVID-19 response will start with Kampala Metropolitan, which is currently with the highest infections, before spreading to other villages in all districts of Uganda. Jingo Francis, NTV.